Hey everyone! Today, I'm going to explain the healthcare claims life cycle from the first doctor visit to the final payment. I'll point out key sections, items, and different types of claims. Let's dive in. It all starts when you arrive for your appointment. The front desk takes your personal information, insurance, eligibility, and basic health details. This is usually documented in an electronic medical record, but sometimes it's on paper. It's important to get this right, as errors can affect what happens next. Now let's create the claim. A claim is like a detailed invoice your provider sends to the insurance company. It consists of several main parts. The claim header contains crucial information such as patient details, provider information, and dates of service. Line items. Each service is listed separately using ICD-10 diagnosis codes, CPT procedure codes, along with other medical billing codes to describe the services provided. Consider these the common language of medical billing. Modifiers and adjustments are also utilized if extra information about special circumstances or additional procedures is needed. Once the claim is put together, it's sent to the insurance company. There, it's reviewed for medical necessity, accuracy, and billing compliance. Many medical offices use clearinghouses or third-party vendors to help with data transmission. If there's a mistake, like a coding error, it's returned for correction. Once everything is verified, the claim moves into the adjudication phase. This is when the insurer makes a final decision on payment based on your plan details and any contractual adjustments. After adjudication, the payment is posted to the provider's account, and you usually receive an explanation of benefits, EOB, which breaks down what was covered and what you might owe. There are multiple types of claims used within healthcare. Let's explore some. Professional claims are for services by individual healthcare providers, such as doctors or specialists, and focus on quality and risk adjustment coding. Institutional claims. These are for services in hospitals or clinics like inpatient stays or surgeries. They also cover rehab centers, skilled nursing facilities, and hospice care. Outpatient claims. These cover services without an overnight stay like lab tests, imaging, or minor procedures, and usually process quickly. There are a variety of supplemental claims that cover prescriptions, dental services, emergency room visits, and more. Remember, different claim types have unique processes, reimbursement models, and form types. For example, use CMS 1500 for professional claims and UB04 for institutional claims. Check out our other videos to learn more about these differences. Sometimes claims can encounter problems like denials or underpayments. When this happens, follow-ups and appeals can resolve the issues. Collaborate with your team to focus on accurate data collection, check pre-authorizations, ensure correct coding, file and submit on time, and conduct regular audits or reviews. Understanding this will keep claims operations running smoothly. Thanks for watching. If you found this helpful, give it a like, ask your questions in the comments, and don't forget to subscribe for more insights. See you next time.